Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
This guest is Dr. John Dennison, and he's not a medical doctor, but he's a dentist. And when I say the term dentist, I just, oh boy. But you do a good job because I've let you work on me.
Thank you.
So why should we worry? Why are teeth, how does it affect our overall health?
Well, you know, you have to understand that periodontal disease has a lot of bad bacteria in the mouth. And those bacteria just aren't going to stay in the mouth. When you floss, brush, chew, when you have gums that are inflamed and bleeding, you're going to push those bacteria down into the bloodstream and they're going to go elsewhere. So a person who has bad periodontal health is 2 times more at risk for heart disease than a person with good health. So you have to consider the amount of bacteria getting in there and the plaque that's being formed because of those bacteria and what it's doing to your heart. It does the same thing in the brain. You get atherosclerosis, the hardening of the arteries in the brain. It can put you at a higher risk for stroke as well. So yeah, so there's a lot of things that are keyed in with the mouth that most people don't think about.
So you've got dental, well, how do you even know you've got dental disease? And that brings up the importance, I guess, of seeing your dentist regularly?
Right. I mean, a lot of times the dental disease will be silent. You won't know it's there. Maybe you have some bleeding gums, maybe a little pain every once in a while, but underlying the gums, you have some bone loss, you have some infection going on, some inflammation. So seeing your dentist on a regular basis, you can avoid those pitfalls. And not everybody needs to be seen every 6 months, and some people need to be seen much sooner than that. We have patients on 3-month recalls, patients that come every 6 months, and others are lucky enough to only have to come once a year to see us.
Okay. Have you noticed with COVID, has it affected, I mean, people coming in to get their dental work?
It has. It postponed a lot of people. People decided that they didn't want to go out, which is understandable. Even though dental offices have historically practiced pretty incredible infection control and we upped our game during COVID, it still was disconcerting to go out and be around other people. So a lot of people got off the regular schedule, and once you're off your regular schedule, you kind of forget to go in. So we're seeing people come in after 1.5 to 2 years with a lot more periodontal problems than they had going into this, and because of that we're spending more time with them and getting people back into a good place health-wise.
So it's important if you haven't been there to catch up.
It's time to catch up. It really is very important to catch up.
Now we talked about health effect, but there's also some cosmetic effect. I mean, and emotionally, I'd love to see people smile, but if you got bad teeth, sometimes you don't.
We've got a lot of options for that. I mean, if you're missing teeth, obviously we can replace them. We've got implants now that can replace anything from a single tooth to a full arch. And then you've got cosmetics such as whitening, where you can do simple things like at-home whitening all the way to in-office whitening. We can do a little bonding if you've got some small chips or rotations, which is just adding filling material to make your teeth look better. And then if you've got a real problem, you can get into clear aligners, which are the invisible braces like Invisalign Reveal. And those will straighten them up. And if you're still not satisfied in that, you can look at dental veneers, which are porcelain shells that go on the front of the front teeth and make your smile look beautiful.
So you can take no teeth, a whole mouth of new bright white teeth.
Right. We can do just about anything. We really can.
One thing I want to ask you before we get out here too is you see ear piercings, you see nose piercings, you see all kinds of piercing now, and you see tongue piercings.
Don't say tongue piercing.
What's it do to the teeth?
You know, if you're lucky, it does nothing. But more often than not, we see somebody every month that bites down, pushing their food off the side, and catches that little ball that's sitting on the top of their tongue and cracks a molar in half. So you're putting yourself at risk for some very expensive dental work just by putting a few dollar stud in your tongue.
Yeah. All right, there you go. Well, thanks for coming in. That's great information. Thanks for the work you do.
Well, you're very welcome. I appreciate it. Thanks for having me.
We'll be right back.